Hello, class, and welcome to Chapter 16, Urinalysis, Blood Fluids, and Other Specimens. The whole objective of this chapter is basically to discuss what additional collecting and transporting that we do other than just blood. Us as phlebotomists, we not only collect blood samples, but we also collect other samples that we don't initially do ourselves, that we get from the patient or the doctor's office or from the nurse, and they collect. When we say we're collecting other specimens, it's basically we're collecting it, making sure all the information is correct and needed on that specimen, and sending it to the lab to get processed the proper way. So that is our job, to make sure that everything is properly labeled, that the orders are included in that specimen that we're transporting to the lab, and for the lab to get it on a timely schedule, or your TAT time, so that they can report the orders back to the physician or the doctor's office that ordered the labs. That is the main objective of this chapter. Now, yesterday I did a PowerPoint on urinalysis. So this is just a brief summary of urinalysis. So basically with urinalysis, we have different types of urine that we will collect. We have what we call our routine urine. It's just a random urine that we collect from a patient. And basically when we collect the UA or a routine urine, we're looking for its physical components. We're looking to see if when we describe physical properties, we're looking at the color of the urine, the transparency versus if it's cloudy, if it has a distinct odor, if it has any abnormalities in the urine itself. That's what we look for when we describe the physical properties of a routine UA. Sometimes we have to collect, when we do a routine UA, it has to be a first morning or overnight collection. So basically what a first morning or overnight collection, it's basically when the patient or the patient comes and urinates into a cup, and it's the first urine of the day. Like when you get out of bed, the first thing you have to go is go to the restroom. Well, that's what we're looking for. That's what we want when we collect a random UA. And sometimes the doctor's office asks for a routine UA or a random urine, and basically they will supply the urine cup to the patient for them to collect, and then they bring it to us, which we are collecting, to the lab for us to process the urine and get results off of it. Another type of urine collection we do is called a timed urine test. Usually that's ran over a 24-hour period, and the test that they're running with this time urine test is a creatinine clearance. It's just to check to make sure, when they do a creatinine clearance, is to check to make sure that you are filtering out creatinines into your bloodstream. They usually run this test with people who have renal failure. They like to run this test just to make sure that their body is filtrating out the creatinines that it needs to be secreted out of the body. So whenever we do collect a creatinine clearance, 24-hour urine collection, not only do we have to make sure that the specimen, the container itself, has the patient's information on it, such as the patient's first name, last name, date of birth, time and date that it was collected. We also have to get that patient's height and weight, because that's how they calculate the creatinine determination off of it. Also, another test that can be run off of a time test, you can use it to test for electrolytes, you can test for hormone studies. A urobilinogen determination can be run off of a 24-hour urinalysis test, but the most common test is the creatinine clearance test, is what we usually run a 24-hour timed urine test for. Also, we'll collect a random or a UA for culture and sensitivity, which goes into micro. And basically, when we're collecting for a culture and sensitivity test, we always have to make sure that the patient decontaminates themselves. So basically, we have to give instructions on how to perform this test to a patient, and it has to be clear and precise. So you have to make sure you know your patients. Now, don't try to use too many medical terms because most people don't know medical terminology. Yes, you do, but the average person does not understand medical terminology. So it's up to you to make sure you simplify those instructions as best as possible while maintaining a professional atmosphere. And if you look at your notes, I do break down the instructions on how to collect a CNS, which is a culture and sensitivity random urine test. Also, we collect urine to be run in cytology. And so basically, when we collect a urine in cytology, they're looking for a specific disease or an inflammatory or a cancer, because you can have pancreatic cancer, or they're looking for something in the cells of the urine, because everything has cells. So, because cytology means cell study, study of cells, if you remember how to break down terminology. So that's basically what we covered yesterday as far as urine samples. How to transport urine is another thing we covered yesterday. When we're transporting a urine, as you can see on figure 16.1, you see that there's a label on the urine specimen itself. We have to make sure that label is on the container itself. It's on the container itself. See where these dots are? We have to make sure that the urine is on this container. We have to make sure that the label is on the container itself. Never ever place it on the lid, because what a tech does is they get 10 to 15 urine samples, and all they do is pop the tops off and lay them down. They don't necessarily lay them down in front of the container they came off of. They basically, what they're testing is in the container itself. It's not on the lid. So basically, when they get 10 or 15 urines, a tech is lining those 10 or 15 urines up and popping the tops off, taking the tops off and putting a dipstick into it, a keto stick into the urine. And they're not going to say who's what. So when we're labeling a urine sample, we have to make sure that the patient's name on there, the patient identification number is on there if you don't have a pre-printed label. Um, if it's a pre-printed label, it'll have the patient's first and last name, the patient's identification, and its date of birth, and then you have to put the time and date it was collected, and of course your initials, because you're the one who got it from the patient. If it isn't a preset label or a pre-printed label, you have to basically put the patient's first and last name, their date of birth, and time and date that it was collected on there. So just make sure you do those on a container. All right. So let's talk about the next thing we have to talk about. Is basically other samples we do in the lab as well. And I know I'm clicking kind of fast because I'm trying to get to the other part. Cerebrospinal fluid. We also collect those. Not necessarily we do the function ourselves. We actually go in, the doctor's office will collect the sample, and we have to basically collect it from the doctor's office. Therefore, we send it off to the lab to be tested. Now, when we're collecting cerebrospinal fluid, it is very, and let me repeat that, let me say this one more time. Very, very, very important that it is labeled correctly. This is a spinal tap. This is something that's a doctor's taking a very long needle and going in somebody's spine to withdraw fluid from their spine. That is a very painful procedure in the first place. We definitely don't want to mess up the samples by not transporting it, by not labeling it correctly. Because if the doctor has to go back and do another spinal tap, you're risking the chance of injuring the patient, because that is in the spinal column that they're retracting this fluid from. So we have to make sure that everything is correct. So if you're not sure about how to label a tube on a CSF specimen, call your lab tech. They'll be more than happy. They'd rather you call them than you mislabeling it and then them having to call the patient back, the doctor's office having to call the patient back due to the fact that you mislabeled it in the first place. So better to be safe than sorry, because the main reason why the doctor pulls a CSF sample is to test to see if the patient has any meningitis, or if they have any nervous system cancer, or if they have multiple sclerosis, or any other disorder that deals with the spinal column. They may have a brain abscess, or they're looking to see what the patient has that is causing them to have nerve tremors or nerve disorders. They're trying to see what is the cause, so they'll draw up a CSF sample for us to run tests. Now with a CSF sample, they can run different tests off of it. They can run a chemistry test off of it. They can do a glucose test off of it. They can do a cell count off of it. Of course, it can go to microbiology. They can do a chloride test on it. They can do a protein test on it. There's a lot. It's a big test. Not only that, they can do immunology studies off of that test. Now, when you get it from the doctor's office, they're labeled as tube 1, tube 2, tube 3. There's 3 different tubes, and they're labeled accordingly. If you see a tube that's labeled 1, we usually put the patient's information, such as the last name, first and last name, date of birth, patient ID, especially if it's a pre-ordered label. On that label, on that first tube, we're going to put the chemistry testing on that first tube. See how important it is? Because that means that's the first tube he filled, and it's the first thing he got when he got the spinal fluid out of the spinal column. The second tube we would label for microbiology, so they can run any culture studies off of it. And of course, the last test would be used for hematology studies or cell count studies. So usually when we get a cerebrospinal fluid, we transport that as a stat lab, due to the fact that the cells do break down once it is out of the body very rapidly. So we have like 1 hour, the most, to get this sample to the lab on a timely schedule. If for some chance it cannot make it to the lab as a stat lab in the 1 hour time frame, we always have to remember that we have to refrigerate that first tube, which is the chemistry tube. It has to stay at a certain temperature so the cells won't break down. The rest, tube 2 and tube 3, can pretty much stay at room temperature, long as it's not too hot or too cold, just the perfect consistency. Because in most hospitals, the thermostat is set at 70 degrees Fahrenheit. It doesn't go any higher, doesn't go any lower. It's set at that temperature. That's why the hospital constantly stays cold at all times. And that's basically what cerebrospinal fluid is good for. Another sample we'll be collecting from a patient is called the fecal specimen, or stool. Usually when we have to collect fecal samples is for the patient who has maybe blood in their stool. That will be called occult blood. You might want to run an OMP to check for ova and parasites. You might want to check for any other uh, organic diseases such as salmonella um, and viruses such as C. diff and everything else. There are a lot of different names and a lot of different tests we can run on a fecal sample itself. Usually these are done at home by the patient, and the patient just comes to bring it to us. Usually we give the patient instructions on how to collect a proper fecal sample, because it's invalid or not a good sample if for some reason the fecal sample has any urine within it. It has to be just the specimen itself. It has to be stool itself, no urine, no nothing. So we have to make sure we give the patient proper instructions when we have to collect a fecal sample or stool sample from the patient itself. All right, so we'll give instructions to the patient on how to collect a fecal or stool specimen properly. Whenever we're collecting a sample for children, usually it's one or two ways. If it's an infant, we would just collect it from the baby's diaper. Um, as best way we can without a urine interfering with it. I know it's kind of hard on an infant because, they usually do both at the same time, but we try to collect it when it's just, and usually we'll just give the diaper itself. We won't even put it in a container at all. Now, if it's an older child, usually the parent has to be instructed on how you have to situate the child on the toilet seat itself and how to use it. When we are transporting a fecal sample, it has to stay at room temperature. It doesn't have to be cold. It doesn't have to be, it just basically has to stay at pretty much room temperature. We wouldn't necessarily put it in the refrigerator at any time. Now, there are different types of stool samples we can collect. We can collect in occult blood sample, and an occult blood sample is just to check if there's any blood in the stool. This is usually done if you have some kind of gastric infection, or if you have an ulcer. They're checking to see, or you might have a colon cancer. You might have some type of lesions on your GI tract. This is what this test is used for. Now, occult blood can be different variety of names. Occult blood can be called, of course, occult blood stool sample, or it can be for sure FOB test or cola screen test. That's the new Cologuard is the newest one you hear a lot on TV about. This is just to check to see if there's any blood in your stool. And you'll have different names for it. You have it called a FOBT test, occult blood test, occult hemocoat test, a goitic smear test, a fecal immunochemistry test. It's different names for this one type of test collection you're doing. The next type of specimen you'll be collecting is called a seminal fluid test, and basically this is semen that is collected from a male patient, of course, and usually they collect this sample to test if the male has had a successful vasectomy, or just check his sperm count, or it could be used for forensics also, and to solve a sexual crime that has been charged. Um, they'll use that. And in order to collect this type of specimen, of course, it has to be free of any spermicide. It can't be exposed to any light because it will break down. It has only a 2-hour transport viability. So you only have 2 hours to transport it to the lab for it to get tested, or else it becomes non-existent. It has no quality or no effectiveness after that 2 hours. Especially if you're doing it as far as forensics to check to make sure for any sexual crimes, you definitely want to get that into the lab on time, because that's somebody's um, life, or somebody who has been um, sexually um, assaulted from. So that's their livelihood we're playing with, especially when it comes to forensic science. So we definitely want to follow the rules as far as getting this specimen in time to the lab. Another type of specimen you can collect is amniotic fluid. Of course, with amniotic fluid is to check to see if there's any fetal abnormalities that we will go. Basically, what this is they are the removal of any amniotic fluid um, from the baby's amniotic sac. And basically, we do this by amniocentesis. And basically, it's just to use as far as DNA studies to check the, you can do a chemistry makeup on it. You can do DNA testing, HLA typing, chromosomal analysis to make sure all the baby has all his chromosomes or he's not missing any chromosomes. It's a lot of tests that can be run off of amniotic fluid. Transporting this fluid or transporting this particular specimen, just like seminal specimens, it can't be in light. It has to be protected from light, because if not, it will break down. Remember, it is cells that we're looking for. So exposed to light can break down cell quality. Another type of fluid or another specimen we can collect is seminal fluid. And basically this is remove fluid that is to test if a patient has had any joint pain, arthritis pain. It basically checks to see if there's any arthritic activity in that joint area. Then you have pleural fluid, which comes from the lung. You have pericardial fluid, which is the heart cavity. You have peritoneal fluid, which is from the abdominal cavity. These are all specimens we do bring to the lab to be tested and to be collected and brought to the lab for testing. Sometimes we see a lot of stuff just come into the lab, especially if we're working outpatient lab where patients in doctor's office are dropping off their specimens after they collected it. Especially if you work in the processing part of the lab, you see a lot of these other body fluids that are coming into the lab to be collected and to be processed. We always have to make sure whenever we get in all these different specimens from doctor's office that they are properly labeled with the patient's first and last name, date of birth, patient's ID, where it came from, what type of body fluid it is, what test needs to be run on. And we always have to make sure that we are wearing our proper PPE and that we are always wearing gloves, because you just don't know what they always say. We always treat every patient as if they have an infection. Same thing when we're just we don't necessarily see the patient, we're collecting their sample. So every sample we see treated as an infectious disease. So we would definitely go ahead and wear the proper PPE whenever we are collecting specimens. Another type of specimen we collect, and sometimes we do some of these specimens ourselves, especially if we work in an outpatient lab service. These are specimens that normally go to microbiology for a culture study. We can collect sputum, which sputum is a pussy-like substance that comes up from your throat area, and we collect that in a sterile container. Another one we can do is throat swabs. Usually when we got to do throat swabs, we're looking for strep. If somebody has strep, we'll do a rapid strep on there. If or yeah, a rapid strep. Sinus drainage is another one we'll do. We'll collect for wound tissues. We'll collect for Ear and eye cultures, we'll collect those from skin scrapes. We'll collect those and run those on the test and everything. Vacuole swabs are just basically swabs that go in the cheek and mouth. These are usually done for DNA testing. These are the ones we go and we swab out the patient's cheek area, and we'll put it in a safety chamber and ship it off to the lab to run DNA testing off of those tests. Now, we just talked about sputum collection, which is something that comes up from the lungs that has a contains pus, sorry, and that's usually run to microbiology to test for tuberculosis is usually what it's for, or to see why somebody has a chronic cough. And they were collected in a sterile container. So basically, we would instruct the patient whenever they're collecting a sputum sample is that, of course, first and foremost, they have to decontaminate themselves. So what do they have to do? Same thing we have to do. Wash your hands. Wash your hands. And when you're collecting it from a patient, if you have to collect it from a patient because maybe they can't really move their arms, so whenever you have to collect it, of course, you have to wash your hands. Make sure you put on proper PPE, including a face shield, along with a mask, of course, your gloves. And the reason why, because that person may be too weak to hold the specimen cup to their mouth. And if they have TB, you definitely don't want to be in that environment without the proper PPE because you don't want to contract it yourself. It's an airborne disease. So we definitely don't want you to contract it. So make sure you're putting on your proper PPE whenever you have to physically collect a sputum sample from a patient. Other than that, we basically give them, if the patient is able to collect on his own, on his or her own, we usually just give them instructions on how to collect it properly. Nasopharyngeal culture collection, usually this is to test for meningitis, streptococcus, influenza, the flu. And basically what a nasopharyngeal culture is a swab. If you ever had the flu, it's a swab. They run up to your nasal cavity and it feels like it's going to your brain, but it's not really. It's just going up into your sinus cavity. It's in your sinus cavity. It's going up to your sinus cavity, so it makes it kind of feels like it's going up to your brain, but basically it's touching, almost it's hitting your tear duct area. That's how you know when you get a good sample. Whenever you do a flu swab and or influenza swab and we go up the patient's nasal cavity and they start tearing up, then we know we got a good sample. So now with COVID-19 in the horizon, it is the same type of test almost as a flu test, but it's reaching past your nasal. It's going really up past your nasal canal. It's a really deep swab. So it will burn a lot because it's going past your sinus cavity into deep into your sinus cavity to see if you have the COVID disease. Right. Throat swabs. The reason why we do throat swabs is to check to see if somebody has strep. We'll do a throat swab on a patient, and basically it's a swab that we would swab around, or they might have tonsillitis. So if they have strep or tonsillitis, we would usually swab around the uvula, and we would definitely want to wear proper PPE when we're doing this because some people don't have good control of their gag reflexes, being that we're going so far in the back of the throat. So make sure you have all your proper equipment ready, such as the nearest trash can if you need it, or basin. So if the patient doesn't have good gag reflexes, they'll be able to do what they need to do once you have the specimen. Hopefully, you acquired the specimen that you need in a timely manner. Right. So, in other words, that's throat swab. We already know we got skin testing is done to check for allergies, which we call a skin prick test. And basically, with a skin prick test, we put different allergens on a patient's either forearm or on their back to test to see if they're allergic to anything. That's one type of skin test. Another type is a TB skin test where you get a well on the forearm of your arm to check to see if you had any tuberculosis. And if the TB dissolves into your skin, you won't have a well anymore. And if it doesn't, you will have a well, which is a well is like a little bitty little bump that they have on the very top surface of your forearm that they check. And if you look at figure 1617, it shows where the injection for TB skin test goes. It's just right under your skin surface, right under the epidermis, and not too far into the dermis. Gastric analysis, this is to check your GI tract, your stomach, gastric, stomach, GI tract, stomach. Basically, it's the emptying out of it where they put a tube that goes up your nose and they incubate you, and it goes from your nose to your stomach, believe it or not. So there's a tube that goes into your nose, down into your stomach. And basically, with this test, it's to check for any inflammation or anything that's going on with your digestional tract or your gastric tract, should I say, your gastric, which is your stomach area. See if you're bleeding inside, to see if you're processing food properly. Right. So, another type of test, which is a good test, is, and it's fairly new, it's called the breath analysis test for peptic ulcers. It's called the H. pylori test or the Heliobacter pylori test. And basically, this is to see if there's any bacteria in your stomach or your intestinal lining that can be causing you to either have ulcers or to have stomach cancer. So this is the new way we test for stomach cancer and if you have an ulcer, because they're so closely related that you might mistake an ulcer and really you might have stomach cancer, or they might say you have stomach cancer and really you just have an ulcer. So this is a new way that they can determine if you do have it. And if somebody does happen to have a positive H. pylori, then they'll do further testing. They'll do blood work at that point in time. But this is just to test to see if you have any antibodies, antigens that they want to detect to see if you have the H. pylori bacteria in your just intestinal tract or your stomach lining. The sweat chloride test is usually done for to see if you have cystic fibrosis. Patients who do have cystic fibrosis will do a sweat chloride, which is they'll sweat more chloride out of their body system than a normal person would. So if a person has cystic fibrosis, they'll test the sweat to see if it has any chloride in it, or excuse me, a higher level of chloride than a normal person would have in their system. So they would properly take those. And the reason why they like to test for cystic fibrosis because it can affect so many areas. If a patient is diagnosed with cystic fibrosis, it can affect their lungs, their upper respiratory tract, their liver, their pancreas. So usually they do this test on an infant who has been positive for sweating out more chloride than a normal person would, or a normal preemie would do, or infant would do. So they test these a lot. This is mostly popular in the Caucasian population per se, than anything. Another thing is, with this is cystic fibrosis is a genetic disorder of the extracrine gland, which is the secretion gland. So if it doesn't secrete properly, it causes a lot of havoc with your upper respiratory tract and your lungs and your liver and your pancreas. So it's very important that we perform this test correctly. Our doctors perform this test correctly. All we're doing is collecting the specimen after he has gathered it. So this concludes chapter 16 lecture. I hope this clears up everything. So I hope this clears up everything. If you have any questions, just give me a text or a call. Enjoy your weekend and have a nice day. Bye bye.